Welcome to the Home and Heart Care Basic First Aid presentation. We have put together a short video with basic information that will help you if and when you encounter situations that require your quick thinking. We believe by obtaining this basic information, you will be better prepared to handle emergency situations that may arise in the course of your day. This video does not replace CPR or basic first aid training. It is, however, our hope it will give the basics you need to act swiftly in an emergency situation. We do encourage you to become certified in CPR and first aid by attending a class offered in your area. These classes will better prepare you for emergencies and offer more details as well. But for our purposes today, we will stick to our basic information. To begin, let's define an emergency. An emergency is a circumstance that requires immediate attention and can sometimes be dangerous. Broken bones, severe bleeding, and choking are all examples of an emergency. Emergencies may also come in the form of severe weather or fire. And emergencies can be life-threatening or non-life-threatening, but they all require our immediate attention. When an emergency arises, we need to be able to offer care until medical personnel arrive. Those few minutes before help arrives can sometimes make the difference between life and death. There are 3 steps in an emergency situation that will help you. First, check the scene and the person. Second, call 911. And third, care for the person. If you think a situation is life-threatening, immediately call 911. But if you are not sure, how do you know if the situation requires you to call for assistance? Well, first, you should check to see if the scene is safe to enter. Second, try to figure out what has happened. Third, check to see how many people are involved. Fourth, decide what your initial impression is about the nature of the person's illness or injury. And fifth, is anyone else available to help? If possible, ask someone else to call 911 for you. But if there is no one else available, it will be up to you to make that call. It is important to get emergency personnel on the scene as quickly as possible. The 911 operator will ask you the location of the emergency, the nature of the emergency, the telephone number of the phone being used, a description of what has happened, the number of injured or ill people, and what help, if any, has been given so far. There are numerous situations that require immediate first aid and emergency services. We will spend some time going over situations that you may encounter on the job, including bleeding, shock, choking, burns, falls and broken bones, stroke, heart attack, and diabetic-related concerns. Before we begin discussing specific emergencies, let's take a moment to become aware of safeguarding ourselves and others from the transfer of disease. You may have heard the term communicable disease. A communicable disease is defined as an infectious disease transmissible by direct contact with an affected individual or the individual's discharges. It can also be transmissible by indirect means such as contaminated surfaces or objects and insect or animal bites. The common cold, influenza, chickenpox, mumps, hepatitis, rabies, and shingles are all examples of diseases that can be of concern as we set about our day. We need to be aware of ways to prevent the spread of these diseases and what to do if there is a concern we have been exposed to them. There are several steps you can take to protect yourself and others from spreading germs that cause infectious diseases. Handle and prepare food safely. Wash your hands often. Clean and disinfect commonly used surfaces. Cough and sneeze into your sleeve. Don't share personal items. Get vaccinated. Avoid touching wild animals, and stay home when you are sick. Home at Heart Care has a communicable disease plan that is accessible from our website, homeatheartcare.com, and is found under Employee Resources. This plan includes definitions, precautions, the use of protective equipment, and examples of situations you may encounter. The plan also includes what to do and how to document any incidents that occurs, as well as guidelines on when to stay home from work when you are sick. Your client may have specific needs in regards to infectious diseases. Your supervisor will discuss and help you understand how to best safeguard yourself and your clients as you work. You will receive training in the specific areas needed as it relates to your individual client. Please ask any questions or voice any concerns. We want you and your client to be safe. We will start our conversation regarding basic first aid with what to do if someone is bleeding. Bleeding can occur externally or internally. External bleeding is blood leaving the body through an open wound. It can range from minor to severe. Often, we can use basic first aid to care for a minor wound. For a minor wound, put on latex-free gloves and apply direct pressure to the wound with gauze or a clean bandage to stop the bleeding. If the bleeding leaks through, do not remove the soiled bandage. Simply place another one on top of the original and continue placing pressure on the wound. When the bleeding stops, clean the area with soap and water, apply antibiotic ointment, and cover with a sterile bandage or gauze. Bleeding internally happens when a person has experienced certain forms of trauma. Internal bleeding may not be obvious, but after trauma has occurred, there are a few signs to look for. Coughing or vomiting blood. Shock symptoms, such as weakness, anxiety, thirst, or skin that is cool to the touch. Bruising or tenderness over the affected area. If you see or suspect any of these symptoms, call 911 immediately. If a person loses too much blood, their body may experience a life-threatening condition referred to as shock. Shock means the body is not getting enough blood flow and therefore not enough oxygen and nutrients to function properly. A person experiencing shock may have enlarged pupils and appear pale or gray. They may feel cool and clammy and be confused or stunned. To treat shock, lay the victim down. Cover them to keep warm and raise their feet higher than their head if possible. Do not give the person anything to eat or drink and monitor until help arrives. While we are discussing shock, we should also mention anaphylactic shock. That may result from insect bites, medicine, or food allergy. If the person is able to speak, ask if they have medication, and if so, supply them with it. Anaphylactic shock can be deadly, so call for help immediately and be prepared to start CPR. Our next topic is choking. Choking occurs when a person's airflow is blocked, and that cuts off oxygen to their brain. If a person is able to speak or is coughing, he or she is not choking. However, if they cannot talk or cough, then you must take action. A person who is choking can quickly become unresponsive, and it is important to know how to proceed. If a person is choking, first deliver 5 back blows between the shoulder blades. Next, you should perform abdominal thrusts by standing behind the victim and wrapping your arms around their waist. Make a fist with one hand and place your fist thumb side in against their stomach and above their navel. Grab your fist with the other hand and pull in and up sharply 5 times. Continue giving back blows and abdominal thrusts until the person can cough, speak, or cry. Next up on our list of emergency situations to overview is burns. A burn may result from simply touching something that is too hot, or it may result from certain chemicals. There are 3 classifications of burns: first, second, and third degree. First and second degree burns can be cared for by removing the source of the injury or removing the affected person from the source. Next, you should run cool water over the affected area. Do not apply ice or any other ointment, including butter. Finally, cover the burn loosely with sterile dressing. Third-degree burns are the most serious and require professional medical attention right away. Third-degree burns may appear black, brown, or white. They may appear charred, but blisters do not develop. To treat a person with third-degree burns, check for signs of circulation and loosely cover the area of the burn. Do not remove burnt clothing or immerse large severe burns in cold water. It can be frightening if your client falls. Your client may just need a hand and a comfortable spot to rest for a while. However, something more serious may have happened that requires your attention. There may be a sprain or dislocation to a muscle or even a fracture to their bone. In some cases, emergency personnel are not needed, and a trip to a healthcare provider may suffice. In this case, keep acronym RICE in mind. R stands for rest, limiting the use of the injured area. I is for ice. Apply ice wrapped in a towel or an ice pack. Continue applying ice every 20 minutes to reduce swelling. C is for compression. Wrap the area in a bandage. This helps stabilize the area, contain swelling, and provide protection as well. E stands for elevate. Elevate the area to limit swelling. These steps will help the healing process and bring comfort to your client. Instead of a sprain or dislocation, falling may result in a broken bone. Sometimes a broken bone is obvious, as you may see the bone protruding from the skin, or it appears bent or crooked. Other times there may only be swelling or bruising. The injured person will have the best answer to what they are experiencing and what happened. If you suspect a broken bone, call 911 for medical assistance. Help the person by encouraging them to stay calm and not to move. If they can tolerate it, apply ice or a cold pack to help bring the swelling down. Then wait with the victim until help arrives. Another medical emergency we need to be aware of is a stroke. A stroke occurs when blood flow to a part of the brain is interrupted. Symptoms of a stroke come on suddenly and without warning. You may notice trouble with speech, drooling, weakness, paralysis or numbness, confusion or loss of consciousness. Use the acronym FAST to check for symptoms. F stands for face. Can the person smile? Is there weakness or drooping on one side of the face? A is for arm. Ask the person to raise both arms. Does one arm drift down or appear weak? S stands for speech. Ask the person to repeat a simple phrase. Do they have trouble speaking or are their words slurred? And finally, T is for time. If you observe any one of these symptoms, it is time to call 911. Time is critical if someone is having a stroke. The longer a stroke goes untreated, the more damage can be done to the brain. Calling 911 immediately can possibly save your client from this brain damage and even save their lives. Next, let's talk about symptoms and courses of action to take when you suspect a heart attack. A heart attack occurs when blood flow to part of the heart muscle is blocked. When a person is having a heart attack, every minute counts. Please quickly call 911. Signs of a heart attack to watch for may include chest discomfort or pain in other areas of the upper body, numbness in the face or extremities, sudden lightheadedness or dizziness, nausea, and shortness of breath. While you wait for EMS to arrive, remain calm and reassure the person. Loosen any tight clothing and closely monitor the person's condition. And if you know CPR, be prepared to administer if needed. Finally, let's talk about diabetes and how it may affect your client. Diabetes is a condition that occurs when the body cannot use glucose or blood sugar normally. When a person is struggling with diabetes, their blood glucose level can fall too low, which is referred to as hypoglycemia, or it can rise too high, which is referred to as hyperglycemia. Hypoglycemia, or low blood sugar, often comes on quickly, and when symptoms present themselves, there are things you can do to help, but the underlying condition needs to be addressed with a healthcare provider. Symptoms to watch for of low blood sugar may include feeling shaky, sweating, a fast heartbeat, pale skin, nervousness or anxiety, weakness or fatigue, and hunger, to name a few. If you suspect your client is experiencing low blood sugar, check their blood glucose level immediately. If it is low, you can use the 15-15 rule. Provide your client with 15 grams of carbohydrates to raise their blood sugar level, and then check their sugar levels after 15 minutes have passed. Repeat the process until their blood sugar levels have been raised. Your client will likely have some hard candy, such as a peppermint or a jelly bean. They may also have glucose tablets available to administer if needed. Another option may be to offer half a cup of fruit juice or regular soda. It would be wise to discuss this with your client so you are prepared to help them if needed. While low blood sugar is often sudden, high blood sugar or hyperglycemia often starts slowly. It can be caused by too much food, too little insulin, illness, or stress. Symptoms to watch for high blood sugar are slow healing wounds, a need to urinate often, increased thirst, hunger, and drowsiness, to name a few. If you observe symptoms in your client, you will want to discuss it with them and see if they are managing their symptoms or have spoken to their doctor about it. If you are uncomfortable addressing these health concerns with your client, contact your supervisor. He or she may have different resources and be able to help your client with these concerns. If you experience an emergency while caring for your client, Home at Heart wants to support you by listening to concerns and answering questions. Emergencies can be an unsettling time, and we want to help you with any aftercare we can provide. We ask that you contact your supervisor or the Home at Heart Care office and let us know what happened. We will fill out an incident report to make sure we understand the emergency and help us evaluate our policies and procedures. Thank you for watching our basic first aid video. We hope that it has helped you and will prepare you to help your client with any emergencies they may face.